The commitment we have seen in trying to make mental health.
Nyingine kunywa maji vizuri ya kutosha, wanasema ukunywe lita ngapi?
My name is Doctor Nelson Murimi. I'm the County Director of Health Services, and I'm with the County Psychiatrist, Dr. Mwenda. So the first thing I would want to say is that one, as I said earlier, is that we really appreciate that there was this opportunity today for us to celebrate this day, because one, this day is key on creating awareness. As you are well aware, a lot of time we talk about many other conditions. We talk about cancer, we talk about diabetes, we talk about hypertension, but we don't talk about mental health. And even the mental health data, because remember, it all starts with the numbers. The mental health data is not very, whatever we have, not just in Nyeri but also in the country, we don't have very good data on mental health. But what we know in Nyeri County is that we have some leading conditions. Of course, if you go to the county referral hospital, you are going to see patients who are admitted with various conditions. Mostly you'll find patients who are admitted with depression. You'll also have patients who are admitted with other mood disorders. You'll have patients who are admitted with anxiety disorder. So we have all those cross-cutting issues. And that's the reason why, like some of the data that we did not collect from our facilities, and I'm sure you heard that we are having suicide cases in this county. So some of the conditions, some of the data that we managed to collect in the county, especially on cases of suicide, which is also not complete, whereby on average in a year we are reporting up to 70 cases of suicide. This is data from both the hospitals and the police department. And we also noted that within that data, majority of the suicide cases are among young men between ages of 30 to 39. And it's so we are trying to find out what is it that is happening in this group. And all of us, of course, we know why this is happening. Generally men, because the society teaches us not to talk much about what is happening to us, and that's the reason why some of these things are happening. Now, the other bit I would also want to say is that, of course, because of the normal stressors of life, and that's why I related COVID-19, like during the period of COVID 2021, there was a lot of stressors. As I said, people lost jobs, so there was a lot of issues that were leading to stressful life. People lost jobs, people did not even have food. We were the routine activities that most people usually do, like I'm used to going to church, I'm used to going to, if I'm a young man, I'm used to probably to go and play soccer. All those things were stopped. So remember, and just as we are told earlier, there are certain things that we do, whether it is physical activities, whether it's routine activities, that basically prevent us from the normal stressors. So when you look at all that, of course, definitely it affected and also worsened the situation. As you know, of course, the economic activity, they also brought in, people lost jobs, that brought in stressors. Then the other bit, of course, is the issues of drug and substance abuse. As we know that there are certain, especially in the central region, we've had challenges with issues of drug and substance abuse. And of course, that also has contributed to some of the mental health conditions. So I think for me, what I would want to say, I think as a department, as a county director, is that we have started we have empowered our communities, especially the community health volunteers, so that they're able to do screening at that level and also counseling at that level through a program that was done a few years back called Problem Management Plus. Additionally, we've also have a very functional rehabilitation center called Career, and we're also in the process of building now a more advanced rehabilitation center, even with an aftercare facility called Igoro. And with the support of Dr. Mwenda, who is coordinating all that, I'm sure a lot of things will be done. We're also working with the county assembly. One of the things that, as one of our partners said, called HERAF, we have developed a mental health action plan, and we are trying to see whether we probably can have a county level legislation. We know that at the national level there are very good documents on mental health that have been developed, but we're also looking at what is it that we can work, especially with the new assembly. Once the health committee has been appointed, what are the things that we can do to ensure that we also move the mental health agenda to the next level. So I think with that, I also want to allow Dr. Mwenda to also say, especially being given that he's a very technical person on these matters. Thank you.
Thank you very much for this opportunity to present this year's mental health theme, which is mental health well-being, making it a mental health a priority. Yeah, this year's theme for mental health is looking at making it a priority at the level of the individual level, family, community, and at governance level. That is the corporate level, the institutions of governance. So at the individual level, there are many things that an individual can do. I'll put it like in an ABCD or ABCDE of mental health, where A is self-awareness. That's in fact the one thing that has the greatest impact in mental health. Remembering that the partners that we have been really helping us in increasing awareness. Like these days for that awareness at the level of community outreaches and at the level of the hospital, psychoeducation. At the level of the individual, you can have the greatest impact because the communities are made of families, individuals, and what have you. So the B side of it, I would say, is the relaxation and the reduction of stress. Breathing exercises. I remember one time we were giving training on PM plus, what that's called problem management plus, where as an individual, what can you do at that level if you are stressed out. Director has mentioned about the social adversities that increase adverse outcome in mental health, COVID-19 and what have you. I'll put them together as social adversity, socio-economic. Those are bringing a lot of anxiety, a lot of depression, and therefore suicide. I cannot overemphasize that. So the C part of the community is connectedness, how you connect with your environment, with the other individual, and at the individual level. That's why during the time of COVID, there was that kind of social activity. People were kind of confined. They were unable to connect. That's why they were stressed up, depression went up, suicide levels, violence, and what have you. You can see that. The D part of it, I would say that the reverse of connection, substance abuse, abnormal coping. Those are the things that we talk about. And the drug management. You can see drug management, pharmacotherapy, or where you use medication therapy to manage clients in the ward. And then it is a small component. I would give it like 10-20% at most of the patients that we have in the ward, as opposed to the community. Community is where most of these conditions are, where preventive and promotive aspect of it has the greatest impact. So then finally the E part of the ABCD of mental health, I would say today, is the fact that exercise is important. When there are clients, even during therapy, we emphasize a lot of exercise, a lot of, like now we are getting some sunshine, being exposure to sunlight, and I said breathing exercise and all that. That one is the things that at the individual level, the individual can do. Director has mentioned about what the governance at the level of the institutions, they can do their part. The MCAs, the county government, the county assembly, oversight, legislation. And I remember one time we trained the MCAs, because most of the time when there are individuals and families and community are in a crisis, the first stop is their MCA. So when they are trained together with the volunteer, the volunteer healthcare workers, those ones are going to give the biggest impact to reduce anxiety, to reduce anxiety before it becomes depression, to reduce depression levels before it goes to suicide. As we speak now, the biggest marker for failure of mental health is suicide level, depression and suicide, very closely related. As we speak, 1 in every 4 clients who are going to the outpatient department of the medical of the hospital have a mental issue. 1 in 4. That's around 25%. And as we speak, every 40 seconds, there is somebody who is dying in the world. Every 40 seconds, somebody has completed suicide. That's how serious that case. And majority of the cases we have in the world, depression. The other bipolar cases, which have a component of depression. Schizophrenia, 1 in 100. Schizoaffective, these are conditions, they are less than 2%. But the greatest impact you can have is by taking care of preventive, addressing the preventive and promotive aspect at the individual level. That's why this theme is very much relevant. I cannot overemphasize that. Thank you very much.